Let's begin by putting things into perspective. Human beings have been around for about 200,000 years, the oldest bacteria for billions of years, and viruses for at least 300 million years. This means that, most likely, pandemics have always existed and been an integral part of human history since people started traveling around. Over the past 2000 years, they have been the rule, not the exemption. Because of their inherently disruptive nature, epidemics throughout history have proven to be a force for lasting and often radical change, sparking riots, causing population clashes and military defeats, but also triggering innovations, redrawing national boundaries, and often paving the way for revolutions. Outbreaks forced empires to change course, like the Byzantine Empire when struck by the plague of Justinian in 541 542, and some even to disappear altogether when Aztec and Inca emperors died with most of their subjects from European germs. Also, authoritative measures to attempt to contain them have always been part of the policy arsenal. Thus, there is nothing new about the confinement and lockdowns imposed upon much of the world to manage COVID-19. They have been common practice for centuries. The earliest forms of confinement came with the quarantines instituted in an effort to contain the Black Death that, between 1347 and 1351, killed about a third of all Europeans, coming from the word quaranta, which means 40 in Italian. The idea of confining people for 40 days originated without the authorities really understanding what they wanted to contain, but the measures were one of the first forms of institutionalized public health that helped legitimize the accretion of power by the modern state. The period of 40 days has no medical foundation. It was chosen for symbolic and religious reasons. Both the Old and New Testaments often refer to the number 40 in the context of purification. In particular, the 40 days of Lent and the 40 days of flood in Genesis.